Doctors are using ultrasound for more than just diagnosis these days. There is a new procedure that allows doctors to selectively ablate prostate tissue. And here to tell us more about this is Dr. Dean Sutherland. Dr. Sutherland, thanks for being with us this morning.
Thank you.
All right, so let's talk about this. This is selective so that you don't have to go in and remove more tissue than necessary. Tell us a little bit about it.
That's right. So normally when you have prostate cancer, you can go in and actually have surgery. You can have surgery through the front of your abdomen or from underneath. You can have different other sorts of ablation techniques. You can use radio frequency. Well, now they've developed this ultrasound technique in England, which is very, very focused. We're already using ultrasound to diagnose a lot of things, as you mentioned, carotid disease, heart problems, to look at your baby in the womb. We've been using it also for uterine fibroids. So if ladies have fibroids that are causing pain or bleeding, then we can already do that. So now this is a new thing for prostate cancer. So it's very focused. One of the things that's really cool about it is you can actually do it while you're in the MRI machine.
Wow.
So the little ultrasound probe is in there looking at the prostate, and the MRI machine is looking at the prostate. So you see the areas that are, are damaged, and you can go in and very focused beams of high-frequency ultrasound ablate just very small parts only of the prostate. You don't have to damage any tissues around the prostate.
And that's one of the main issues, because some of the other treatments damage the nerves, and that can cause some other problems for men. Explain some of those.
That's right. So that does cause some erectile dysfunction for men. It's very common after a prostate procedure to have that. So this apparently has a good nerve-sparing side effect of doing that. So they treated 42 men in this one study that we're looking at this morning, and 41 of them did very, very well. They didn't have really significant problems after that with erectile dysfunction.
And another thing is urinary incontinence, right? That could happen.
That's definitely true as well. And we see that pretty frequently. That not only does that happen normally with aging, but also with prostate problems, prostate hypertrophy, where the prostate gets larger, can cause problems through urination. But so we don't know if we're actually going to use it to treat that, the prostate enlargement necessarily so much right now as cancer.
As the cancer. And I was reading the way this works is actually heats up that tissue and kills those cells.
Yeah, there's a really neat video that's online where they show exactly how they do this. It's very, very focused. It heats up only the tissue that you're interested in. And if you look at this video online, it's called HIFU, H-I-F-U. It just blasts little parts of the prostate, with this high-frequency ablation, and kills those cancer cells. And then hopefully you have, very few side effects.
And very targeted. That's always important. And also, it's kind of similar if you're looking at breast cancer, like to a lumpectomy instead of a mastectomy. It's kind of a good way to relate that? That's
right. There's actually different sectors of the prostate gland, so you can have cancer in one sector and not have it anywhere in the other part of the prostate. So if you can go in and just target that one area, then that's preferable, of course. Then you have even less risk of damage to everything else.
Okay, and we're just in the trials of this. This is just in the beginning stages, right? So when can we expect that maybe this would be something that patients could have?
I don't know. I asked one of our local urologists, Dr. Kenneth Bragg, about this the other day. And he says there needs to be a few more trials done just to make sure that it's really, truly safe, because he's worried about damage to the other tissues, as you know.
All right, so we will look forward to see if this is something that patients have an option for treatment in the future. All right, well, thanks for being with us this morning.
Thank you.
And we are now going to video chat.